Very positive news for victims of AIDS, and we're going to be talking with someone from the AIDS Project and finding out about that news and what's new in regard to AIDS. Have been announced in the past few days regarding the dread disease AIDS. First of all, an announcement came out of France from the Pasteur Institute that they had in fact isolated a virus that they felt was the cause of AIDS. And we in our own country, the National Institute of Health, also found a virus. They're two separate viruses, but apparently may become one and the same. And to clarify this and other things regarding AIDS, we've invited on our program this morning the director of Project AIDS, his name Bill Misenhimer. Nice to have you here.
Thank you.
So to clarify now, I mean, it sounded to me coincidental that, one in the weekend they were talking so much about the French isolating the virus, and then Monday morning we have our announcement. At the moment, there are two distinctly separate viruses?
We're not certain. The French at the Pasteur Institute have isolated a virus which they have named lymphadenopathy virus. The National Institute of Health has isolated a virus which they have termed HTLV3. Suspicions are among the research community that they are in fact the same virus, and that's what's being worked on right now to prove that.
So now they're trying to, in other words, really literally get the viruses together and find out if they are one and the same.
Yes, they have sent samples of each virus back and forth, and the difficulty in France was that they weren't able to grow it in sufficient quantities to be able to make that much determination about it.
Because they have less AIDS in France?
No. Well, they do have less AIDS in France, but they weren't able to grow it in their actual research labs as successfully as the NIH was able to grow it here.
Mm-hmm. It's an interesting kind of phenomena because what this means is within about 2 or 3 years there may be a way to cure AIDS, but what it means immediately is life goes on as usual. So what's been the reaction in the gay community?
Well, first of all, it doesn't mean that there will be a cure in 2 to 3 years. Most medical researchers are skeptical as to whether or not there will be a vaccine in the next several years. The actual change in treatment of people that are currently diagnosed, there will be no change in their treatment or no change in the people that are going to be diagnosed or no change in the needs of those people, which continue to rise.
But the vaccine would be a preventive measure.
The vaccine would be a preventative measure, but before we get a vaccine developed, the first step is develop a blood test which will be able to detect the blood, to eliminate it from blood banks, which should be able to be done relatively soon, I would say within the next 6 months, according to Margaret Heckler. The second issue is that once that blood test is established to screen blood, there will have to be a blood test developed, and then that blood test itself will take much research to determine if you go to a doctor, get a positive blood test for this virus, what does it really mean? We really can't say that.
But it will mean that you've been exposed to AIDS.
It will mean that it's in your system, but there's a myriad of things that could relate to. It's not something that's conclusive without months and months and perhaps years of research.
So are you really saying that this means nothing to the gay community?
Absolutely not. I'm saying that it means it's the first step in the journey toward finding a vaccine and a cure.
What's the reaction on the street?
People are confused. Some people are misinterpreting it as being a cure and as being a vaccine is imminently around the corner. And we need to caution people to know that that's not true so that risk reduction will be avoided, because risk reduction is one of the things that we profess at the AIDS Project.
Last year we had a representative from Project AIDS on our program. I believe it was a woman, and she was on talking about AIDS and talking about a candlelight march that was taking place, and she protested in a way against the fact that more funding was not being given federally to fight against AIDS and find out the cause. What funding did occur, and do you feel it has been enough?
The funding for fiscal year 83 I think was something like in the $20 million range, and fiscal year 84 it was $47 million, if I'm correct, and fiscal year 85, the administration is recommending to Congress that there be $55 million appropriated.
Is that enough, in your opinion?
Absolutely not. I don't think there's ever going to be enough until the disease is, there's an input to the disease, because it's a contagious kind of thing. So it's something that until we find a cure for it, I don't think enough money can be spent.
In the scheme of things, though, there have been 4,000 cases of AIDS since 1981 diagnosed or reported. That's a minor amount in when we look at all the other diseases that we have, and I'm not minimizing the fact that AIDS is dangerous. 1,700 people have died since then. But it seems to me that the government has reacted very quickly and very fast to this. And here we are now with the discovery of the virus, and we certainly haven't found those and some other diseases we've been pouring billions of dollars into for many, many years.
Well, the isolation of the virus is, in fact, a good step. The fact that it's contagious and at the current rate that if it's doubling every 6 months, sure, right now it might be 4,000 cases. However, those are only the cases that got reported, only the cases that get diagnosed. There are very strict guidelines as to whether the CDC will diagnose a case. There are countless other number of AIDS cases that have gone undiagnosed and unreported. If it continues at the same rate, by the end of next year there will be approximately 50,000 cases. And that's only a year and a half away if it doubles that every 6 months. And if you extrapolate that, which might be unreasonable, but if you extrapolate that out into 1989, there will be 13 million if it doubled every 6 months.
The gay community has been critical of the lack of funding and blamed it many times, the lack of funding, on the fact that it is affecting primarily gays in this country. They have said in the past that they feel that if it were a disease that was epidemic among heterosexuals, immediately there would have been more funding, and therefore, a sooner cure would occur much sooner. Mm-hmm. Do you agree with that?
Yes, I do. I see the stigma that's attached to the disease. It's not unusual, it's not uncommon. The horror stories we could tell you about people that have AIDS, not just because they have AIDS, but people that I know that are gay that have gone to the hospital, nurses wouldn't go into their rooms because they're gay. I mean,
because they have AIDS, not because they're gay. Because they're gay?
This person was in the hospital. It was known that he was gay.
I see what you're saying.
He was in for an appendectomy, and the nurse wouldn't go into his room. The fear is there. Mm-hmm. And one of our projects, one of the purposes of our project is to educate not only the general public and high-risk groups, but also health professionals about the truth about AIDS. You can't get it by walking into a room.
Let's do more education when we come back, because there are a lot of myths about AIDS and how you get it.
Before we go to commercial, I just want to answer one thing. Just get on the other side of the question for a second. Mm-hmm. There is a heterosexual disease, and maybe homosexual also, but it's herpes. It is not fatal, but it's a disease that has caused a lot of pain, a lot of concern to a lot of heterosexuals who have said, we need this taken care of.
Right.
And so to say that, and yet yours, the disease of AIDS has gotten a lot of funding, and there's a virus been found. I just think you're wrong in saying that because it's a gay disease or a homosexual disease, nobody cares. I think we've proven by this discovery that people care.
Well, if I could respond to that, herpes is not just a heterosexual disease. Homosexuals get herpes as well. Herpes is also not life-threatening.
Yeah, I think that's a big difference, Jeff. I must say I disagree with you in this instance, because it seems to me, what is the death rate amongst AIDS victims? It's over 50%.
But I'm saying that the result is, he's saying that not enough attention has been paid to it because of the homosexual
stigma.
Yeah. So, but the result is that there is now a virus, that they're going towards a vaccine, that there's been, since 1981, in 3 years, they have found out what this is with only 4,000 cases reported, and with herpes, we have found really nothing so far. So I think that
if people were dying of herpes, you would have seen a lot more substantial action taken, and you would see. And who knows? There are rumors in the medical community now that there are cures for herpes. Mm-hmm. They're just rumors, though, unsubstantiated.
We'll take a break, and we'll be back.
Meredith and I with Bill Misenhimer, excuse me, terrible Freudian error there, the AIDS project director for Los Angeles. Interesting, Bill, that you are on leave from Xerox to do this work, and I think that shows a lot for Xerox and for you personally to get involved with this. We're taking your calls. We've been discussing the discovery of the virus HTLV3, which is believed by scientists to be the virus that causes AIDS. Now let's start off the line 5.
Hello.
Hi, how are you? Your question, please, for Mr. Misenhimer.
Yes, thank you. I want to know exactly, is there any risk at all, any possibility of my contacting AIDS if I only, let's say, I'm orally copulated by a gay with AIDS, but nothing else? Is there any chance of me catching it then?
The main method of transmission is exchange of bodily fluids. If you were, in fact, had a cut on your person, and the person you were engaging in sex with had the AIDS infection, there is a slight risk in that. That's true.
Only a cut. In other words, if...
But did you say orally copulated?
Yeah, in other words...
Well, yes, then there is definitely a risk.
By someone else.
I'm not doing it. They'd be doing it to me only.
No.
That's still true. If it depends, the bodily fluids is the issue. That's where we suspect the virus is carried. Depending on how the kinds of mucous membranes that you come in contact with, if they are cut and if you are cut, there is a slight possibility that you may be.
What I'm wondering is if there's not a cut, but obviously there's an opening into the body, will the germ or virus be transmitted?
It's difficult to say. We don't have any documented cases like that to say that yes, you could be, or yes, definitely you would come down with it.
Are you considering saliva a bodily fluid?
Saliva is not suspected as a risk.
I see.
I'm so glad to clear that up because I was looking here for a list that you provided of myths that people think that you can get AIDS, by kissing someone or hugging them or whatever. And no, you can't. One that wasn't on there was drinking from the same cup, and obviously you're passing saliva when you do. And there are many of my gay friends that I've, shared a glass of wine with or something, and I want to clarify that you cannot then get AIDS by drinking from the same cup.
It's not suspected as a method of transmission. No.
Okay.
But you can get a nasty cold.
Absolutely.
Let's take another call. Good morning, line 4. You're on the air.
Good morning.
Hi.
My question is, if the scientists are spending so much time trying to perfect this cure for the AIDS, if society is not condoning this sort of lifestyle as proper for young men to follow.
You're feeling that society condones it by the amount of money being spent?
Yes. I mean, I think that if they're going to spend their time trying to find a cure for something, they should be trying to cure the diseases that people are born with and not ones that they're giving themselves by doing something that's...
Well, of course, I would say that doctors have a Hippocratic oath to heal all people, regardless of their sexual preference. But let's let our guests respond to you.
I would suggest that if AIDS were started in the heterosexual community, first of all, your opinion would be different. AIDS has been prevalent in Central Africa for decades. Would you say that about them if they were Central Africans? The issue that we're faced with here is a disease that's rapidly exploding. It is not just limited to homosexuals. It is beginning to spread in the heterosexual community, particularly in Europe. Now, what are you going to say to the people in Europe when it spreads there? It's not just gay people.
Thank you.
Okay, line 1?
Yes, my question is, what is the possibility of a straight male catching AIDS from a young lady who may possibly have had a sexual experience with a bisexual man?
The possibility is remote, depending upon whether or not she was infected and has actually shown symptoms of AIDS. We don't know. She would have to be infectious, and again, it depends upon whether you have cuts in your body and the body fluids or blood is transmitted from one person to the other.
He also said with a bisexual male, he didn't say that the male had AIDS, so that would probably be much less
absolutely
risk.
none, unless the bisexual male were infected and passed it on to the woman.
But the thing that we're suggesting here is something that you have alluded to, is the explosive nature of this disease and how it is spreading to the heterosexual community. And as I understand AIDS, it has almost geometrically expanded.
It's doubled every 6 months.
I still don't understand. Can a straight man, since I'm straight, and I have a girlfriend...
Are you there?
Yes, I'm here. I still don't understand. I didn't get an answer there.
Oh.
Can a man, me being straight, if a young lady that I were to meet on the street had some experience with a bisexual male,
Right.
and then how would she know that she has contacted AIDS, or how would I know whether she has, or if it's that possibility with BD? It's obvious, you can tell, but...
Right. At the present time, you would not be able to tell. She would not be able to tell if she were infected, nor would you be able to tell. The risks are very small, however, at this point in time, even though it can be passed supposedly from a woman to a man.
So yes, it is possible, but probably not probable. But then he brought up another myth. You cannot always tell that VD is present, and that's
true.
That's another of the myths. Okay.
Let's go to line 3. Good morning, you're on the air.
Hi. I was just interested in that question, that how they could do so much so fast, and with other diseases they haven't really done that much, and all the money and time has been put into the same thing. You didn't answer the question.
I didn't answer the question.
No.
What would you like to hear again?
Much work so fast, but with other diseases, nothing's come up. And people have been putting money into it, and we've been spending time. And
Well, I don't know that it is so fast. I mean, 4,000 people have been diagnosed, and 4,000 people will probably eventually die.
sure, that's happening, but other things are happening too. And
Right, but are the other things as contagious and growing so rapidly as this one?
you've done a lot of work with this, and
You didn't answer his
I would-
question.
I would-
He asked you, he said, but are the other diseases as contagious and growing as rapidly? I don't think they are.
no, they're not. That doesn't matter.
Well, yes, it does.
When you talk about a substantial, possibly 50,000 people by the end of next year, I think it's very important, and you double that every 6 months beyond that, and you will be staggered.
Also, there's children who have been known to contact AIDS as well, and heterosexuals, so it's not just a gay problem.
That's right.
Okay.
Pediatric cases are not included in LA County.
Really?
Not in the numbers.
We want to mention that there is a free brochure available. If you're interested in getting it, we'll be telling you more about that at the end of the show, but you can see it right there, AIDS, Acquired Immune Deficiency Syndrome. It answers a lot of the questions that we've raised today, and we'll be giving you a hotline number at the end of the show,
And it's
too.
not a bad book to pick up, even if you're in the straight community, a booklet to pick up to answer some of the questions that we've been trying to answer here on the telephone.
That's
It's
right.
very concise and very frank. I applaud you for getting that out.
Thank you for being with us,
Thank
Bill.
you for having me here.
Okay, we'll go to Ted and the news.